Thank you so much, and thank you everyone for being with me. I'm not sure where you are in the country, but good morning or good afternoon. We are going to be talking about canine separation anxiety, and I would love to give first a huge shout out to Assisi Animal Health for continuing to provide continuing education for all of us. And to provide it for free. That's pretty incredible, as they have been doing this entire year, um, to try to make it easier for all of us to stay on top of different topics during the pandemic. So again, thank you to Assisi Animal Health. So let's start talking about separation anxiety in dogs. We know that dogs are social animals and therefore by nature prefer the company of people or animals to being alone. Even dogs that appear independent, perhaps spending hours napping in a distant bedroom, base their independence on the fact that owners really aren't that far away. And as many of us know, there's a world of difference between dogs who wander to a quiet spot in the house and those who are left alone for, you know, potentially hours as owners go to work, run errands, or, prior to COVID, participate in social activities. And we also know that, dogs being dogs, each one will have its independent personality. Some dogs may seem, indifferent about human comings and goings, especially, once they've been able to eat and go outside and eliminate, then they don't really need us anymore. um, Others, though, while maybe they're not entirely indifferent, they resign themselves to the inevitable and sleep through the day. But then, you know, there is the subset that when certain dogs are left alone, they become increasingly and significantly distressed. So, if we were to give a clinical diagnosis of separation anxiety, it's really applied to a variety of behavioral issues that have one thing in common: that the dog is left behind by its human, by its owner. And it can present in a number of different ways, and with a range of intensities. So, and you see a couple on the screen, right? We see the pug looking out the window, and we know he's sad. He's, watching the owner leave. And then we have the, I don't know, Australian Shepherd, possibly a cattle dog on the bottom who has chewed right through the drywall, right? So destructive chewing, digging, um, usually at exit points, so windows, doors. Um, Sometimes they will urinate or defecate in the house because they are that stressed. And there also typically is persistent vocalization, so barking or howling. So some owners are absolutely convinced that the destructive behaviors are directed, on purpose towards them as the owner because the pet is retaliating. But, you know, part of the reason for that is, the objects that are commonly damaged typically include personal items belonging to the owner, such as books or clothing. Shoes are very popular. Sofa cushions, where the owners will have been sitting. Sorry, and then you know what these objects have in common is that they're frequently handled by the pet owner and carry that owner's scent. And the contact with those items typically serves to remind the pet of the absent owner. That triggers anxiety, which then triggers destructive displacement behaviors. And, we're not really sure how prevalent separation anxiety is, because unless there's evidence left behind, then the pet owner might be completely unaware of their pet's distress. So, understanding what dogs do when they are left alone is important. At least 50% of dogs, and probably more, will exhibit some aspect of separation distress at some point in their life. And so, in addition to the high levels of stress that it creates in dogs, separation anxiety has a significant impact on the owner's life as well. Think about the impact on that human animal bond. The fallout from separation anxiety, again, the destructiveness may lead to relinquishment, so giving up to a shelter, which I'm sure many of you are familiar with, having to, take in that dog. And also, it may lead to euthanasia. Oftentimes, it disrupts again that human animal bond to the point where the owner will stay home 7 days a week if they have to avoid that unwanted behavior. So, treatment then, it really has to be aggressive, but with the entire veterinary team, and also with you as shelter workers and the pet owner themselves, then what we're going to do is we're going to come up with a treatment plan with caution to prevent any increase in that dog's anxiety. So the last thing we want to do is create more anxiety. So treatment, therefore, should be aggressive. The successful management of separation anxiety includes teaching the dog to tolerate owner absences and correcting those problems that we've been talking about: the chewing, the scratching, the digging, the barking. And so that is what success looks like for the dog. Success for the owner, what we have found is that owners absolutely want to address this, but we found that they're more compliant and the pet sees more improvement the fewer the instructions given to the owner, and obviously the clearer that they are. So then what we're going to do is a simplified program that deals with proper homecoming and departures and teaching relaxed independence away from the pet owner. This simplified program, what we're going to do is we're going to help teach the dog to decouple those departure cues from actual departures. And oftentimes we will do this in combination with drug therapy. So the veterinarian will be prescribing anxiolytics based on what is going on, the severity, the owner's input. And we're also going to use, as I've been mentioning, a multimodal approach, but we're also going to add to that targeted pulsed electromagnetic field therapy. So we want to set the dog up for success, right? During behavior and environmental modification, we want to have the owner make arrangements, to avoid leaving the dog home alone. Again, we're trying to set this dog up for success. So we're hoping that, during this time, that the owner can either take the dog to work, perhaps a doggy daycare, maybe leave with a neighbor or a relative or a friend. And while crating might seem to be, the option to use, because many of us do crate our dogs, but in this instance, with canine separation anxiety, and while we are trying to manage this and decouple these habituation cues, crating isn't recommended. I'm sure that some of you have seen what you're seeing on the lower right-hand corner of the screen, right? The dog tries to escape from the crate, and never mind the injury or the destruction to the crate, the dog himself can create some really serious, severe self-injury. So part of the approach is we first want to create a safe haven. If the dog is barrier anxious and digging, chewing, scratching its way through through distress, then we want to identify a dog-proof area. So the kitchen, maybe a mud room or a spare bedroom. And this safe haven should be a space where the dog on its own chooses to sleep at times. And so what we then want to do, sorry, having a little trouble with my mouse there to move the screen. We want to have the owner invest in a tall, obviously tall is relative depending on the size of the dog, but a tall, securely bolted, and importantly, easily open gate for the safe haven, because many dogs panic when faced with a shut door. So we're going to, create that safe haven. Our veterinarians are going to initiate drug therapy. Dogs with separation anxiety, we know they're stressed and they're often traumatized, and they have an impaired ability to learn new tasks. And so that is not going to work with our habituation, our desensitization, because we have to get the dog to a point where they are able to learn new tasks. So behavior modification is absolutely an effective treatment of separation anxiety. We also, and again, depending on the veterinarian's diagnosis and prescription, we are most likely going to have anxiolytic drug therapy as well, because that is going to help facilitate treatment and reduce anxiety, even more so than training or management changes alone. So drug therapy is commonly used to assist with behavior modification. And remember, it's not only helpful, but it's humane. It's putting that dog more at ease so we can help them to learn new behaviors to overcome this incredible stress. So we're also going to encourage owners to track progress with journals and videotapes. We need to get a baseline to determine if the management, the therapy is working. So a baseline for panning and pacing, urination, defecation, barking, everything that we've been talking about, as well as these signs and symptoms, their timing and their intensity. So a video camera can be aimed in areas where elimination or destructiveness has occurred. And typically we want to record 30 to 60 minutes. That should give us enough, time to provide a reasonable idea of the dog's distress immediately after the owner leaves. Audio typing, that might be enough if barking is really the primary complaint, but videotaping is just going to give us that much more information, obviously. And we need to, repeat as much as needed to monitor progress. And a journal of the dog's behavior is also helpful. And we should ask the owner to include elimination behavior outdoors as well, and when the owner leaves the house and returns. So we also want to manage hyperattachment. So dogs that can't adapt to being separated when the owners are home, they may be less likely to tolerate the owner's actual departures. So these are the dogs, think about that, stick right with the owner at all times. And so to encourage independence from the owner, we want to provide a mat, an open crate, or a safe haven room where attention is offered when the dog is calmly sitting or lying in that area. So again, the dog goes into that area on their own, and that's when we're going to reward and give that encouragement. So that area then can become that safe haven when the owner is actually departing. Food dispensing toys are a great way to help the dog to be distracted, and it helps with counter conditioning. So they also can be offered when the dog is anxious and it's associated with a stressful event, or even a potential anxiety trigger. So again, by providing, feeding puzzles or feeding treats, as you see on the screen, the dog is being psychologically stimulated as well as distracted when the owner leaves. So they're not going to see that owner leave and then think every time they go towards the door, then they're going to stress out. So these food dispensing toys are great ways to help manage hyperattachment. So I've mentioned it a couple of times, but a big part of separation anxiety management is habituating them to cues of departure. So think of it as desensitization, because that's what we're going to do. And desensitization can be helpful for dogs that become reactive at the moment of departure. So when owners walk to the door, or maybe when they, go to grab the handle or the doorknob, and then they walk out. And so what we are seeing is, again, this is a multimodal approach to help make this happen. So once these dogs have been on an anxiolytic drug for at least a month, and then they've learned to manipulate those food dispensing toys in their safe havens, that's when we are now ready to help the owner with desensitization. The technique introduces repeated exposure or habituation to departure cues. So again, what we've talked about, turning off the lights, maybe picking up the car keys, putting on a coat. These departure exercises can be an important component of separation anxiety treatment. And this process is going to help dogs disassociate these cues from actual departures. Now, another part of the multimodal approach is targeted pulsed electromagnetic field therapy. And we're going to talk a little bit more about that after we talk about the desensitization process. So desensitization begins, right? Those repeated exposures to those habituation or those habits of departure cues. Again, the owner goes to pick up their keys, they turn off the lights, maybe they, turn the door handle. So this entire management approach is helping dogs disassociate those cues from actual departures. And once we, are getting dogs more habituated with that, then we want to change it up a little bit. Maybe have the owner leave through a different door, or maybe the owner goes out and puts their coat on in the garage, or maybe they're, parking down the street. It's important to, change things up, change the amount of time in between, picking up their keys and then going to the door. As long as we are continuing to habituate and desensitize to the actual departure cues, the better we're doing for that dog with canine separation anxiety. So once the dog has responded well to simulated departures and changes in those departure cues, then we can begin working with owners on desensitization to actual departures. So at first, they should be brief, and the owner shouldn't leave. The door can be approached, touched, maybe even opened slightly, but then closed. And the duration of departure should be determined by videotape. So, in other words, if the owner leaves for 5 minutes, but the dog is calm for only 3, then we know at the beginning 5 minutes is too long, and we have to shorten that time frame. Depending on the dog's tolerance, the first actual departure may last from a few seconds to a few minutes, with the length of each subsequent departure gradually but randomly increasing. Because again, we don't want to do everything exactly the same, or the dog will pick up on, on our, again, habits, and will just change their separation anxiety to the new habits. So once the dog has responded well to those simulated departures that we've been talking about, and then what we want to do is start encouraging the owner, or helping the owner, if you will, to recognize breaks in calm behavior. So it's important that we are educating owners to look for these breaks. And those can be rising, maybe approaching the door anxiously, starting to vocalize again, or acting nervous. That's going to tell us that desensitization session has moved way too quickly. So we have to learn to end the sessions after a few successful but shorter departures. What we want to do, as we said earlier, is set the dog up for success. And then in subsequent sessions, the dogs should participate in less challenging exercises, but that result in success. So we also want to minimize the difference between owner presence and absence. I know many pet owners like to leave the TV on, 24 hours a day. So whether we're home or not. And this is, decreasing the impact of owner departures. And so it's suggested that owners not change noise levels, so radio, television, and don't change the lights or the gates when leaving. That's going to include minimizing owner-dog interactions prior to the owner leaving and then returning. And that's oftentimes difficult for owners, right? Because, we love to visit with our dog and say, oh, it's going to be so hard to leave. And then when they come home, that's one of the things that we all love most about dogs is how excited they get to greet us. But for our canine separation anxiety dogs, then, or I should say separation anxiety dogs, then we need to not reinforce the interactions when we're leaving or returning. White noise machines are very popular as well. It can help muffle outside noises and provide background sound rather than silence. And, instead of white noise, dogs have been shown to love classical music. So, for the classical music fans out there, just, leave the radio on a classical music station, or talk radio, because then there's other, human beings talking. Now, we need to avoid punishing the dogs for anxiety-related behavior. By definition, right, we know that punishment is unpleasant and it's aversive. And so whether the dog is chewing, digging, barking, all of those behaviors are manifestations of distress or what we see because the dogs are stressed. Shouting and disciplining is just going to worsen their anxiety. So, reprimanding for bad behavior after the behavior takes place, that's not going to prevent the behavior from reoccurring. I mean, think about it with, puppies. How many times, in the olden days have we heard, oh, if they go in the house, then you have to yell at them or worse. And it's like, no, they've already done that behavior and they don't realize that your anger, your yelling at them has to do with, that behavior. So, we need to get away from the punishment um, in in separation anxiety. Exercise. If we can, get owners more frequently exercising, exercise has a very calming effect. It helps to decrease anxiety and provide suitable social interaction. Maybe not right now, but we will get back there, I think. It also provides um, those feel good hormones, serotonin, dopamine, endorphins. And we already talked about the social interaction. If we can get dogs exercising 2 to 3 times a day, or even, hey, a couple times a week, it will have a very positive effect. Now, I've also been mentioning, as part of the multimodal approach, the targeted pulse electromagnetic field therapy. And you guys know this as Calmer Canine, right? It's a gentle, effective, safe, and drug free treatment system specifically for separation anxiety in dogs. And what it's doing is it's delivering that pulsed electromagnetic field to the area of the brain responsible for causing the symptoms of anxiety. And that is that part of the brain is the amygdala, and a lot of if we can stimulate that, we can get those endorphins and those positive pleasure centers, overcoming the negative, the stress areas. And so with the Calmer Canine, it's effectively returning that anxious brain to a more balanced emotional state. And Calmer Canine is also helpful with other anxieties such as thunder phobia, noise sensitivity, which one of my own dogs has, travel anxiety. So another important thing is, as I've been saying, is it's a multimodal tool. It's been shown to work alone, and is safe to use with other solutions for anxiety, such as medication. That's why that's why I keep reinforcing the fact that managing separation anxiety is a multimodal approach. We have a number of different tools to use, and when used in concert, then we can most definitely help that pet owner, but most importantly, that pet, to decrease their anxiety. So we know that the Calmer Canine system includes a comfortable, easy to use vest that holds the device in the proper position over the dog's head. And here you see an adorable pitty with what looks like a halo, and that is the Calmer Canine. And really just 2 15-minute treatments per day for 4 to 6 weeks have been shown to significantly reduce signs of separation anxiety in dogs, including a lot of those that we've been talking about: the barking, the whining, the howling, the destruction. And probably the important thing is, not only does it reduce signs, but with lasting effects. So again, significantly reduces the signs of canine separation anxiety, and probably most importantly for both the, well, especially the pet, but the pet and the pet owner, is that it improves the quality of life. So, and isn't that why we're all here today, right? We want to improve the quality of life of every creature, cats, dogs, birds, it doesn't matter. And so by utilizing this as part of that multimodal approach, we have seen an improvement in the pet's quality of life and in that human animal bond, which we talked about at the very beginning, and the long lasting results. So, as I mentioned, it does help with other anxieties such as storm phobia or noise phobias. Well tolerated. It's very gentle. It's sensation free. So it's not like the dogs are feeling anything to then become more anxious about, right? It's effective as a standalone therapy, which I mentioned, but I love to use it with separation anxiety as part of a multimodal approach. So what we need to be doing is discussing similar situations in the future that might trigger a recurrence, and then how to best avoid that happening or there be a problem. So we know that an owner or if an owner, if we know that there's going to be a change in that pet's schedule and that dog's schedule, then we need to come up with a plan and we need to plan it out well in advance. Changes should always be made very gradually in a way that can be easily tolerated by the pet. Medication should probably be instituted at least 4 weeks prior to any major change. And think about it, whether the owners are going on a trip or maybe there's a big move happening, then the veterinary team, the veterinarian will make that medication recommendation. And we want them to be on that about 4 weeks prior to the big event. Because what we're trying to do is think ahead and plan to help prevent the anxiety that we know can develop in association with sudden major changes in the pet's life. So remember, pets are social animals. They prefer the company of people and animals to solitude. We want to help rebuild that human animal bond that we see, you know, torn apart with separation anxieties. Everything that we've talked about in this past half hour takes patience, but with patience comes that rebuilding of the human animal bond. And regardless, it's in the best interest of the patient. So, multimodal management. Okay, we definitely should be using a multimodal approach to separation anxiety. We talked about the desensitization and the habituation to cues. We've talked about medication. We've talked about targeted pulsed electromagnetic field therapy and food dispensing toys and safe havens. So if we can take our time and work through all of those and have patience, then we will get to a much calmer and happier, less stressed dog, and therefore less stressed household. So what we want to see is the two images on the screen. So thank you all very much for your patience.